Hello, I'm Marilyn Crawford, founder and CEO of Howa Health and co-creator of the new Howa U School. Today, we're joined by two very special guests for our Rare Disease and Disorder course. And our featured topic today is pandas. Now, I'd like to welcome two very special guests that will be interviewing Ramona and Marcus. Welcome to our course today, and thank you so much for creating a greater awareness of what is pandas. We're going to learn a lot today together. So Ramona, please do a quick introduction.
My name's Ramona. I'm the mother of two beautiful children. Marcus to my right here, he's 19, and I have a 15-year-old daughter. I also have a husband and two dogs. In my real life, I'm a physician assistant and primarily in pediatrics and urgent care. Yeah, that's what I do.
Very exciting. I heard you also do a little bit of dance coaching, which sounds super fun.
Yeah, my dance coaching days are a little bit over, but I'm real active in the dance judging world now. So I do a fair amount of traveling with that, and it keeps kind of both sides of my brain, my creative brain and my science brain happy.
Very fun. And Marcus, congratulations is in order. You recently graduated high school. And is it true you're starting a career potentially in real estate soon? Excellent. Now, Marcus wanted to join us today because Marcus is someone who has actually experienced pandas. And as we know, it's hard sometimes to understand from a patient perspective what it's like to go through being a patient of a rare disease and disorder. So we really appreciate you joining us, Marcus. And Ramona, having your expertise as a physician assistant, as well as a mom and caregiver, going through this experience brings such a wealth of experiences and will really help other people that might find out that they have a child that has pandas. So I think this is a great opportunity for us all to create a greater awareness and broaden our knowledge on this topic. So let's start our interview by asking you, Ramona, could you please explain what PANDAS stands for and what are the signs and symptoms of pandas?
Well, PANDAS stands for Pediatric Autoimmune Neuropsychiatric Syndrome after strep. And it's actually a tiny subset of a bigger umbrella of neuroimmune disorders, one called PANS, which just stands for Pediatric Autoimmune Neuropsychiatric Syndrome, and then even a bigger umbrella of autoimmune encephalopathies and encephalitises, which literally means swelling of the brain due to a hyperimmune response to whatever stimulus. So it could be an infectious stimulus. Specifically, PANDAS kind of came out, it was almost a little bit of a mistake about 20, 30 years ago. There was a researcher, a pediatrician at the National Institute of Health, and her name is Susan Swedo. She's considered the grandmother of the disorder, that noticed for centuries there was noted in the literature that there was something called Sydenham chorea, which is a they noticed a behavioral, a psychiatric response after strep that also included choreo movements of the fingers and of the toes. That's where it actually comes from. And so she started, that's where the acronym PANDAS. And, in any researcher, they have to be very, very specific. They can't say, geez, do infections cause psychiatric symptoms? She was studying she had to really kind of narrow in her research, and that's where it came from. Well, after a few years of the research, she noticed that this was a much bigger, she actually has said because it kind of led to some controversy within not only the literature, but in terms of clinical practice, because so many kids have strep. right? And they're like, well, how can you make the association between strep and psychiatric and motor symptoms? And because all kids get strep, right? There was kind of that old, remember the old Epstein-Barr,
Oh,
everyone thought
yes.
every symptom was because of Epstein-Barr. It kind of got globbed into that. So she has said in some of her research that there's a little bit of regret. It was necessary. It was a necessary way to attack the research. But she's a little bit regretful that it only, looked so much at strep and not at the bigger picture of potential infectious triggers of the disorder. But in a nutshell, what it does is specifically when we talk about the pediatric onset, and we can talk about adult onset, because that's kind of been born out of all of this research too. And that's a whole nother session. But specifically with kids, they don't know why. They think it might have something to do with the thymus gland that kind of sits here. Not the thyroid, but the thymus gland that's part of the immune system. And they think that causes almost a hyperreactivity to an infectious or environmental, like mold, insult. And so specifically, again, with PANDAS and not PANS, the strep is the infectious trigger, and those hyperreactive immune cells cross the blood-brain barrier and go into the base of the brain, the area that's called the basal ganglia, which that's your fight or flight response. That's where we get that. It's part of the primitive area of the brain. It's our fear center. It's very primitive. So when that's stimulated, you can get all sorts of symptoms, from classic behavioral symptoms to ADD, ADHD, hallucinations, anxiety, depression, and then as the inflammation of the brain continues to expand, motor tics, vocal tics, almost like a Tourette's syndrome.
Wow.
And in some severe cases, seizures. Some kids, there's actually a subset that actually has an anorexic, a severe food intake. And pretty much the hallmark of the behavioral or the psychiatric component is usually an OCD. And people tend to think of that as, hand washing and whatnot. But there's so many other components to OCD. It could be rumination of thoughts, the constant thinking, something's gonna harm them or they're gonna harm others. So that's kind of the hallmark. So there's OCD. It's a sudden onset with a temporal relationship to that infectious agent, and then really a whole host of other things that kind of would typically fall under what people would consider mental health. But now we're starting to learn more and more about mental health is really physical health, especially.
Exactly. And I think creating that awareness through these types of interviews and patient discussions is really important, because there's always been a stigma when we were growing up, you and I, Ramona, of nobody talked about mental health. Nobody understood mental health. And it really is so much physical health, and the physical and the mental are joined together now. And we're finding out so much more and able to really come together with treatment plans that are much more successful. And so at that point, I want to talk to Marcus. So Marcus, at what age did you develop your first symptoms of this rare disorder?
Probably I want to say 9.
9 years old. And it was right after you had a strep infection that you noticed it?
He actually had 2 back-to-back. He probably doesn't remember a ton of it. Okay. That's one of the blessings and the curse. Not a lot of kids, some kids won't remember a lot about their symptoms.
Oh.
It's
that's good.
yeah, in some way God works in mysterious ways, right? Because there's so much incredible suffering. But yeah, I mean, I think I could probably go back to, as a parent where you're like, scratch your head and you're like, was that maybe one of the early signs that something may have been amiss?
Mhm.
But when the proverbial stuff hit the fan, yeah, that was about third grade, about 9, 10
Third
years old.
grade. I loved it when my kids were in third grade. That was actually one of my favorite years in their schooling when they were younger in elementary school. So Marcus, what was it like to be in third grade and have something happen within your body that you didn't understand? Do you remember anything about that feeling?
I don't really remember too much, if I'm gonna be honest. I don't remember that far back.
Okay. And was it just that one episode, or was it episodic where you would get it again and have, a reoccurrence when you had other strep infections?
After that first kind of initial, I pretty much it's been with me ever since.
Yeah.
It just started getting pretty manageable, but
Yeah. What happens in a small subset, somebody will get the infection, in pandas, the strep infection. And they'll have quick intervention,
Mhm.
and because it was so sudden and so acute, it's classic and people recognize it, and you get lucky and you have a healthcare provider that says, you know what, I don't need to send this kid to psychiatric care, I need to give them an antibiotic.
Right. And
Right.
that's how simple it is too.
In some, but in a good portion of other young children, there's waxing and waning, and unfortunately, it almost like primes the brain to continue to react in a hyperreactive fashion. So
Okay.
with subsequent re-exposures, you may even not get sick from the illness. You could be traditionally asymptomatic from the illness, but it triggers. So in Marcus's case, we got trigger after trigger, and strep looks like it was the beginning, but what we found out with further workup down the line, and a lot of heartache and a lot of tears and a lot, because it was affecting everything in this child's life, everything.
Mm-hmm.
From social, emotional, familial, academic, everything. Um, and so we found out that there was actually infectious triggers outside of strep in his case, specifically one called mycoplasma. And that's one that causes your typical bad cold, what we call walk-in pneumonia, right? In medical circles, we call it community-acquired pneumonia, but the mycoplasma was one of his, and it's super common. It's what kids get. It's what we adults get. It's very, very common. And then he also had another virus in the panel called HHV6, which is another common childhood, but he couldn't clear it, and his body kept acting very hyper reactive to it. So we would go through periods of calm, followed by periods of, weeks to sometimes months where he was either partially functional, and sometimes even a couple weeks where he was bedbound from the symptoms.
So anybody watching this interview that is kind of hearing some things that relate to things that have gone on with their children, what's one of the first conversations you start having with your pediatrician? So for example, if in some cases, your child had strep, and now you're saying that some of these symptoms would come up pretty quickly after the strep infection. Is it within days or weeks after strep?
It's usually within days, but the challenge is, as a parent, kids get sick all the time, right? It's kind of the nature of being a kid. You get exposed, you get sick, and it just happens. So sometimes the temporal relationship kind of is not that obvious.
Right.
Sometimes it is, but a good portion of the time it's not. And that becomes the challenge. But absolutely, if some of these things start to ring true, then keeping a history, keeping a chart, bringing that to the pediatrician. And I'm just going to say it, we were very fortunate to have a family practice doc that actually, she didn't know about pandas, but when I brought this to her and I said, look, I think this isn't normal. I know this is where you have to trust your parental intuition, you know? And I'm like, this has been a happy-go-lucky, funny child that now, like, overnight, because I got some people, were like, oh, early onset schizophrenia. I got all this nonsense. No. Yeah, stop. No. There's something, so when I brought this to her, she was very open-minded and said, well, let's look at this further. And really was open to, like, well, yeah, we don't want to utilize antibiotics, willy-nilly, but let's look at the bigger picture here. And what is the, what's going to do less harm? Is, him continuing to suffer going to cause more harm, or what's the worst harm in that we use, a couple weeks of an antibiotic and see empirically if we get an improvement. Right. And in his case, we absolutely did. But unfortunately, the waxing and waning of how much it remitted and came back was the biggest challenge. And that's what happens probably in about 70% of the PANS.
Oh, really? That's a high percentage. Well, Marcus, it sounds like you were pretty lucky that you had a great physician and a great, great parents that were advocates for really honing in on your symptoms and looking for, opportunities to explore different treatment plans and really work as a team with your physicians towards that. Now, in my research, I learned that PANDAS is specifically known to be a pediatric disorder, as we've been saying, occurring between the ages of 3 through 12 years of age. But in rare cases, children over 12 could also be diagnosed, and in some cases, some adults, which is, like you said, another time we'll talk about that. But and it sounded like within my research that some of the symptoms would resolve in several weeks to several months. And so within each of these episodes that would crop up, Marcus, was that the case for you, that it would be a few weeks or a few months and then you'd have a little bit of rest from it until maybe you got another strep infection or one of these other viruses?
Yeah, so it pretty much just waxed and waned. Some days would be I took it day by day. Some days would be completely terrible, but other days would be like fine, like nothing ever happened. And then the next day it'd be terrible again. So it's hard to kind of figure that out.
Right.
It's not constant. It's like changing all the time. But I did notice once I turned 18, for me, it kind of started to slow down. I was able to manage it more.
Excellent. We're so thankful for that as well. So it sounds like you, out of the research that I've done, had a very severe case of it because it was coming back, and you had sounds like a couple different strains of things that were triggering it. Now, I had a really bad case of strep in college, and I think, like we said, most children have 2 to 3 cases of strep a year. Annually. My strep caused a massive seizure that I wound up in the hospital over. So I think people don't understand because, colds and viruses and strep infections, they're just something that we're so used to when we have kids, when our kids are growing up, but they don't have that broader understanding that, for most people, that is something that occurs, and it's something that you can normally control with, pretty standard treatment plans. But for some people, our bodies react differently. So how is this different? Why do some students and patients have a different reaction that's so severe?
Well, It's interesting that you bring that up because, now that we live in the age of COVID, right? This was something that we parents and healthcare providers that are interested in the field have been jumping up and down and say, please listen to us. There's an infectious component to these neuropsychiatric symptoms.
Right.
And now, out there in the new vernacular, right? I got COVID brain, right?
Mm-hmm.
We know that there's this subset of folks. I mean, now that we're seeing this as a pandemic, a subset of folks that respond in such a way that it's not, a one and done. They have protracted symptoms where they have brain fog or depression or fatigue or, even motor, joint swelling, all of these rheumatological or autoimmune type symptoms. And your question is a great one. And that's what most researchers are looking towards. We really don't know. We do think that there is a little bit of a genetic component, a genetic susceptibility. We do see familial clusters. There tends to be a little bit, but folks that kind of follow, genetics of that MTHFR gene,
okay.
and the COMT gene, there's these
Mm-hmm.
little tiny mutations that have to do with how people metabolize certain medicines and B vitamins and whatnot. That seems to be, but
Interesting.
we just don't know. And this is where integrative docs can be a great help because their understanding of biological resistance and cumulative insults seems to be much greater. We as traditional Western medicines, we're like, we want to know the trigger, fix the trigger, give them the fix or cut it out and we're good. But integrative docs, and that's where we really got the most help for Marcus with an integrative pediatric neurologist. And that was part of the reason why we moved here from Illinois to Arizona, was the integrate to be near her. They're thinking about the whole person and how all these pieces of the puzzle, genetics, environmental stressors, emotional stressors, infectious disease, diet, exercise, sunlight, fill in the blank, how it can be, for one person, you could be fine, but all these little tiny things can start becoming where it becomes the proverbial straw that, breaks camel's back. And so getting all of those things in alignment, in the end, really does help a good portion of these sufferers. And I think when Marcus said, when I turned 18, he finally got the maturity to recognize when things were starting to feel a little bit out of whack, address that right away, and adjust his diet to be a lot more healthier. I mean, he still is a teen, and he, has way too much crazy Starbucks. Out here they call them Dutch Bros, but they're like full of fill in the blank, green, orange, blue, red stuff with caffeine and
right.
stuff
The
that
caffeine
yeah.
is so hard. Neurologically, you want to reduce your neurological triggers. So things like caffeine and going to decaf is a really smart thing, just because it's a trigger. Some people even say vegetarian diets is a trigger. Chocolate is a trigger. So anything that's a stimulant could, really create for a lot of neurological disorders, different triggers.
Yeah.
So smart for you to, go that route. And I think so much of concern right now with COVID, finding out more about other viruses and things that create these types of triggers is interesting. I too am fascinated, Marcus and Ramona, with genetics and genetic studies, and have done a lot with my own genetic studies. where I found out I have an increased risk for blood clots because of one of my genetic mutations. I also found out recently that I have an increased risk for having a cyclonic storm if I get COVID-19. There's a new research a tool out that you can run your raw DNA through to find that out, which is kind of cool. But yes, there's so much to be said about that. And I'm just so impressed by, by the opportunity to talk to both of you about this specific rare disorder. So from a treatment standpoint, we talked about antibiotics. So that would be something that they would go on an antibiotic course. And if the person didn't even know that they had strep, there's a blood test, a titer test that they could find out if they had strep recently in the last month or so.
Yes.
So that's probably something Marcus had. But Marcus, what other treatments do you remember being things that you felt were helpful besides the diet, which sounds like that's key? What other treatments do you think really helped you?
Honestly, when I was sick, I would find myself getting into really bad habits for like my sleep. Like if I didn't get enough sleep, I was staying up all night, sleeping all day. I was basically nocturnal for like 2 years. And then once I started to kind of get my sleep honestly probably plays a huge part.
Yes.
For me, because in just getting those habits, kind of like eating healthy, exercising, just the stuff that people overlook a lot, kind of like meditation. Like it sounds weird. People like don't want to talk about that much, but it's helped me a ton.
Oh, and I think just calming our minds from all the activity, that just kind of shutting down technology, and so many of our young, girls and guys are so into their technology, they're answering texts all night long, or on their social media streams, or playing video games until 3 a.m. So I think what you're talking about is something that everybody could benefit from, whether they have this particular disorder or any condition or disease or disorder. These are all things. So we've got, let's eat healthy, number one. Let's get our rest, number two. Number three, let's be fit and active. Let's rest our minds from technology and some of the outside noise that's always going on, so that we can have that respite. It sounds like a spa day for me. I don't know about you, Ramona, but you're in Arizona and you've got some of the best spas on the planet. So as soon as COVID's over, I'm visiting you both and we're going to take a spa day together, because that's
you got it, girlfriend. We're there. And since Marcus blessedly lives in the present, that's what he does now to maintain his risk of flares of the disease coming back, and it's what he does to maintain being in remission. But during the acute, when the disease was really at its height, he was on 21 pills a day.
wow.
He was on
that's not fun.
He was on anywhere from 2 to 3 antibiotics. He was on 2 antivirals, immune suppressors,
Wow.
prednisone, of course, all the other immune support factors, vitamins and things like that. But then he also had monthly IVIG, which stands for intravenous immunoglobulins.
Right.
And those are actually antibodies that are pooled, the blood product. And for 2 days a month, we would have an infusion nurse come to the house. He would hook Marcus up for anywhere from 6 to 8 hours, and he'd have these infusions. And they really don't know how they work. The idea is that it pushes out the bad immune cells, and the healthy ones kind of take over. Again, one of the presents that COVID has given us is kind of bringing these technologies and these treatments to the forefront, but at the time it was considered highly experimental. We know it's a blood product, so there was all the concerns about the limit in the supply of a potential blood product. To make one bottle, and they do it based on body weight. To make one bottle, he would need 100 donors to make one
My
bottle.
goodness.
And over the course of 2 days, he would have 4 bottles.
Marcus,
So,
you're like a superhero.
yeah, so 400 people donating a month. And then if you can imagine the cost and getting insurance to pay was very, very difficult. And even when insurance did pay, there was a huge amount that wasn't covered. And that is part of the challenges of PANS and PANDAS and families. There's the human suffering that you see your child. There's the family suffering on the relationships within the family, and the financial suffering for sure. Here I was lucky and I had access to great medical minds. I knew how to read the medical literature. It didn't help when he was suffering like that. I had a lot of medical knowledge, kids suffering, and sometimes the acute treatment plans worked, where we give them, high doses of ibuprofen or prednisone, antihistamines, things of that nature to calm down his brain. And other times it took, a couple weeks for it to fully kick in. But we lived that life for where he was in a chronic, acute on chronic disease from age 10 to age 15.
Well, that's a long time to be going through all that, Marcus. Did it make you mad? Did it make you confused? Was it frustrating? That for me, that would be just unbearable almost.
Yeah, because when I was younger, I didn't really know exactly what was happening. And so I was like, what the hell is going on? Like, why can't I just go to the doctor again and have him fix it?
Right.
I didn't understand that it was more of a slow thing rather than a quick fix.
Yep.
There's no quick fix to this. And so I didn't realize that when I was younger. And so I would try everything and be mad once it didn't work. It's like,
he was quite despondent. Can I share everything? I mean, there was a ton of suicidal ideation because, I make it, correct me and jump in, but, the things that kids normally get to do, go outside and, run with their friends and have their minds just play and be imaginative. He would immerse himself in technology to numb his brain, to just not think about it. But then there was times of very, very dark times, and there have been children, and have there been kids that have ended up in the hospital because, the seizures associated with it? Yes. But more commonly, when the depression and the OCD is at a peak, suicide risk is real, and it has happened. It has happened to some.
It's important to bring that out. I mean, that topic right there just brings such a different light to why it's so important for us to understand so many more rare diseases and disorders and bring greater awareness to it. And I have a passion for that.
I'm gonna challenge you a little bit on the rare disorders. This isn't as rare as people think.
Really?
No. Most of the literature right now points to, now obviously there's a huge continuum of how kids suffer, right? But they think it's 1 in 200.
No, and see, I was looking for that stat because it is categorized in that rare disorder.
Yeah, the NIH.
But
if you're talking about PANDAS, yes, probably uber rare. But then when we start talking about the bigger category, umbrella category of PANS, and a lot of the literature, I think 20% of adult onset depression or OCD might have had an infectious trigger.
Really? And see, and with everybody talking about COVID and talking about viruses and autoimmune and our immune system in general, this is just a great introduction to looking at this from a broader perspective. So I appreciate
Right.
you talking about that. And Marcus, hearing this from a patient perspective, this is not fun. It's not fun to go through, have any rare disease. It's not fun to have any chronic health condition. We're so thankful when our children are healthy and smiling and happy and doing well throughout their childhood. But the reality is there's many, many children that do not have that lifestyle where they can say, I am 100% healthy throughout my entire childhood. There are many that have different pediatric conditions. There are many that are not knowing why they have to go through this. That's a typical response, is why me? I think that's a typical response for adults. I had cancer this year, so you have to ask yourself, why me at some point in time? But it's our personal resilience and our family support, our friends, our healthcare providers, and our teachers and instructors that have a better understanding of what we're going through that helps us to get through it. So I think I've always felt, and Marcus, you tell me if I'm wrong, or if you want to expand on this, but I've always felt that by telling people about what's going on and sharing my story, it helps me. It helps me get the support that I need. It helps my family get the support that they need, or the people that are involved within this. And I think it's the people that are not sharing. The people that aren't sharing are the ones that it kind of manifests itself and spirals more out of control.
Well, so I actually have a story. I was probably my freshman year of high school. I met this kid. I'm not gonna say his name or anything, but we talked a little bit. We weren't like super close friends or anything. And then sophomore year, I hung out with him a couple times. And then we like didn't really talk about any kind of illnesses or anything. But it turns out he actually had the same thing.
Really?
But I don't really think he went to this to get support the wrong way. He kind of turned towards drugs and alcohol, which led to an eventual OD. But had he talked about it and gotten his story out there, he could have gotten a lot more help.
Yeah, that's a good point to make. So there are ways to approach this that are a lot easier and healthier. And then there's some folks that maybe just aren't getting the support that they need.
Well, and I'm gonna sound, at the risk of sounding like a little bit of a Debbie Downer here, but I'm gonna make it real. When you talk about support systems, because of the neuropsychiatric symptoms associated with this disorder, you find out real quick who your support systems are. Your parenting will get judged, like if when they're acting out or having severe behavioral manifestations of the disease, that you're like, I can't punish this. I can't give consequences for something he has no control over.
Right.
It's very common for pandas parents to be judged, and you can probably remember this, when I would give them, you don't always get it right. You don't know that they're just, whether they're just being a teenager that's being, pushing back, or whether this is, the beginning of a flare, right? So there were many times where I got it wrong, and I would give a consequence and he'd be in the middle of a flare. And guess what? I just made it worse. I just escalated the situation.
Right.
And that did happen. But not to minimize anybody's suffering with any other disease or disorder. But I will tell you, this isn't a disorder where people show up with their ribbons and pins and casseroles at your front door and say, it's very isolating, because when they're flaring, you cannot bring them out. They're not with their friends. Their friends will start to you know, I mean, kids are like that, right? They see something different and they're like, they don't understand it. Um, I had family tell me, you know what, if I just, you know, basically was, if I was a better parent, or if I wasn't so permissive, which I don't think anyone would claim I was a permissive parent, but I got that, you know. I'm like, well, how come I got one kid who's like acting perfect and the other one in the same exact situation is not? And it's extremely isolating. If I didn't have the support system, in all honesty, if I didn't have Pandas Network and Arizona and Illinois Facebook group of parents, I would have lost my mind, literally, because they were the only people. Yeah, they were the only people that consistently told me I was not crazy, and neither was my child. There's actually a documentary
Oh,
on
there
this.
is. Good.
Yeah, it's called My Child Is Not Crazy.
That is awesome. We'll post some of these resources that both you and Marcus felt were valuable, and other family members. And we'll post them in the course curriculum so people can have access to that. Is there a lot of books on it?
There are some. There's not a lot, but there's some pretty decent ones out there. And specifically for pandas and pans in the school setting, there's a couple of good ones out there. And again, pandasnetwork.org is a great clearinghouse for those support systems, regardless of the state that people are in, or even country, because it's an international group. So there's all sorts, and you know, provider outreach, centers of excellence outreach. There's just a few. Stanford, University of Arizona, University of South Florida, and the NIH. That's pretty much where you kind of got to go for advanced treatment if you don't have a short, acute, treatable, wrap it up in a nice, pretty bow. Type of situation. So yeah, Pandas Network is pretty much any of those things you'd find.
Fantastic.
They're there. Yeah.
Marcus, I think you should be writing a book about this.
I don't know.
He's talked about it actually, and I've always encouraged him to.
Idea.
But I don't know that he's fully over to the other side yet to see what, I mean, and that's what I would tell parents: expect this to take longer than you think. You know, like he said, you know, he would go to the doctor, and you know, he hated going to the doctors. He's like, they're full of it, because he wasn't getting the quick cure, right? And it was more of a process, and that, you know, expect for it to take way longer than you think. Expect that it's going to take a number of different modalities to help. So I don't know that he realized how much in the past 2 years that he's contributed to his path to healing, in recognizing, oh, you know what, I need to be a lot better about my sleep. I need to, all these things that he said, you know.
Exactly. I love
sleep, fitness, everything. And those were all things that we tried to do when he was, you know, 10, 11, 12, 13, 14 too. But try telling a 15-year-old that's in a huge flare and their brain hurts, and the only release they get, or escape, probably not release, but escape they get, is actually just being, you know, a madman on a video game to just like block everything out.
Oh,
that's a mind-numbing activity. And we actually got he actually found his own treatment too in CBD and medical marijuana. We got a lot of help from that as well, and that's a whole nother topic too, in terms of the endocannabinoid system and whatnot. And that's been the CBD and the CBG are a huge part, and I think that really calmed down a lot of the brain inflammation as well.
Now, isn't there also, you know, certain fats that you can consume that, like I know in some different cases, maybe even doing a keto diet?
Yeah, well, he's on a high quality omega. That's part. Now he takes 7 pills a day, and he's on a high quality omega. He's on milk thistle that helps detoxify things, and a high quality multivitamin, and of course vitamin D. And the autoimmune portion of his illness burnt out his thyroid, so he'll be on thyroid replacement for the rest of his life. Yeah.
Marcus, you certainly are a fine young man that has an amazing future ahead of you, and you have endured so much at such a young age. I just want to applaud you for getting through this and getting to the point now that you do recognize what you need to do and are able to manage the condition much more than you were, several years back. I had epilepsy as a child. So I had seizure medications when I was growing up, and that kind of messes with your brain quite a bit as well. Not only does the seizures mess with it, but it also the medications. So sometimes it's the effects of the condition that you have, and other times it's actually the medications that you're taking that can either help or hurt, or a little bit of both. So it's a little bit of a balance or a juggle. But I did outgrow that whole thing after that last one, age 19. When I was in college, that was like my last big one. And then I went off of seizure meds around 20 and went on to have a fabulous career in healthcare. And to be able to talk to you all about this is just fascinating. So last question, Marcus. If you are newly diagnosed, what is the best advice that you can give somebody who's 10, 12, 13 years old of just how to get through this, to get to the point that you are now? What's your best advice?
Oh, I could be cliche and say, like, listen to your parents and stuff, but just find something you're passionate about that, like, you like doing when you're having flares. For me, it was video games. I got into like coding and all that kind of stuff, and that could lead to a career. And so you just gotta find something that you like, whether it's a sport. I liked basketball when I was younger. I would be outside all night long, dribbling, shooting the basketball. It would help me out, whether that's going to the gym, weightlifting, just finding something that you can really do every day and you actually like, and something like productive that you're also passionate about. I think because if you're passionate about a couple things, maybe just one big thing or a couple extra things, it can kind of distract you and give you a goal. Because a lot of times if you're kind of feeling really down, depressed about your kind of life, your situation, still doing that's not really going to change anything. And so you can distract yourself by having like positive passions.
You had the taekwondo too.
Yeah, I did taekwondo for a little bit too.
Excellent. That is so well said. Well said, Marcus. That's excellent advice. And again, I always do have a focus on a specific, disorder for these conversations, but this advice applies to any condition that you're suffering through as a child or as an adult. These are great pieces of advice that I think are helpful to all of us. So very well spoken. And what a great family to bring a focus to this amazing, opportunity to just expose more people to something that they didn't know about. So we'll go ahead and we'll get some resources from you to post into the curriculum for more continuous, ongoing learning opportunities. And we want to thank you so much for just joining us today, and so proud of you, Marcus. Great job. Keep an awareness going so that you can share your story with others, because it's a powerful story. And we hope to talk to you, Ramona, about maybe some other things in the future,
Absolutely.
about some other connections, to other viruses and things that are going on, especially with COVID. The numbers are rising. So sometimes we can make some associations between the things that we know about something like this particular disorder to other types of disorders that have some similarities. So let's keep the lines of communication open, and you guys have a great day. Thank you so much.
Thank you.